Anyway, coming up, COPD. It's like, I think, the third largest killer out there right now. It's a really big problem, but there's some solutions. Listen in today. We've got Dr. Matthew Burks upcoming, joining us right here from USA Stem Cells on 1250 Wins WHNZ. This is Senior Voice America. Evan and Deb coming back at you shortly.
You're listening to Senior Voice America on 1250 Wins WHNZ. Here's your host, Evan Gold.
All righty. Well, you know what? It's always good information we have. We've got Ask a Doctor segment coming up right now. And if you've got a question, give us a call at 877-897-8255. We're going to be talking about COPD, chronic obstructive pulmonary disease, and it is a big problem in America, actually, in many parts of the world. Today, Dr. Burks.
I'm delighted to be above ground. How are you doing?
That's that old saying, right? Every day above ground is a good day, right?
Right.
So,
right.
So you guys have a lot of things going on down there at USA Stem Cells, and I mean, your COPD treatment is really becoming revolutionary, isn't it?
You bet.
So,
sure is.
So talk a little bit about what this treatment... Well, first of all, let's talk about COPD. I mean, it's become a major killer in America, hasn't it?
Yes, it has. It's the fourth leading cause of death in America now, and it's projected to become the third leading cause of death in the next few years. Wow.
Wow. I mean, that cigarette smoking is coming back to haunt a lot of people, isn't it?
Yes, it is.
So now, you know... But what the typical treatment has always been something just to sort of help you along, right? I mean, it's no curative or anything like that. It's just, you know, sort of help you breathe a little bit better, right?
Right. It's generally inhalers, steroids, and oxygen, and it's just to help you maintain.
Right, right. And your new treatment is quite a bit different. We talk about that a little bit.
Well, my father has COPD, and back 10 years ago, he had a surgery and became more short of breath after that. And what I found was it seemed that people with COPD had just been pushed to the side, that nobody thought that anything could be done to actually reverse the disease, and I just didn't want to buy that. So I went looking, and I found different ways that would help people breathe better. And I used those ways on my dad, and indeed they did. Now, I have a different way of thinking about medicine and what to do for treating people. First of all, I always go after the cause where possible and try to remove that. And then second of all, I believe what I see. So if I find a treatment that helps one person, I know that it might help another person.
Right.
And if the treatment is not harmful, then I don't mind applying that treatment to another person. By and large, the medical community, though, will not step out of the accepted bounds of what they're doing with regard to treating COPD. And a lot of it is because of the philosophy of they see what they believe.
Well, and it's a big problem in medicine, isn't it, sometimes, where, you know, they just keep just covering over the problems. They're not getting to the root and the causes, right? That's
exactly right. And, you know, if it's shoved down your throat day after day after day that a particular disease is incurable and there's not anything you can do but help people maintain, then nobody looks for a cure. And I think that that's where we fall down. We don't look for a cure because we don't believe there is a cure.
Right, right. Well, and there's a lot of money being made in not curing things, right?
Yes, there is.
It
is not profitable to cure things.
I've always heard that in the medical business. You know, just keep treating. And it's not that they don't try to cure things. I know. I mean, Moffitt Cancer Center's on with us regularly, and they're doing everything they can to help cure cancer. But there's many times that, people just don't, they just keep treating the issue. So with your new treatment, I mean, it really is a change of thought. And I know, you're working with stem cells, but it's people's own stem cells. And then there's a whole other side of the treatment. I know we have a caller on right now. I think that's been through your treatment. Hold on one quick second here. Dr. Burks, Dick, how are you today?
I'm fine. How are you doing?
Great. You're calling us from Melbourne, Florida, and you've actually been to the center down in Sarasota, right, at USA Stem Cells?
Yes, I had the treatment done in February 6th, 7th, and 8th.
And how's it going for you right now?
Right now, much better than I had anticipated. It seems like my friends and relatives notice a lot more difference than I do. But I do know that in December at Christmas time, I was not able to walk across the living room floor without help. And believe it or not, today I played golf. I played golf in a scramble. I didn't have to walk too much, but I did play golf. So it definitely is working for me.
How many months did you have to take off of golf?
I'm sorry?
How many months could you not play golf for? There was a long...
I haven't played golf in 6 months.
Wow. And so, and you said you're not noticing as much, but your friends and your family notice it. But I mean,
it's hard for me to notice. Because I still am a little short of breath, and I still don't have much stamina. But it's very obvious to them that I am doing much better. Of course, I know I'm doing better, but they think I'm doing better than I do. So, but I'm doing very, very well.
Well, let me ask you a question. Before the treatment, I'm sure you'd have conversations where you didn't go very long without coughing. How are you doing right now?
Well, I'm doing quite good on that. Used to be I couldn't talk on the phone to my kids because after about 2 or 3 minutes, I would start coughing, run out of air, run out of breath, and so then I'd have to cut the conversation short, not be able to talk to them. Right now, I can talk to them as long as they can stand to listen to me.
It's pretty impressive. Dr. Burks, is this something that you're hearing on a regular basis?
Yes.
And
it is.
And is there more treatment? I heard him say he had been there for 3 times or something. Is it an ongoing thing that you do more and more treatments, or is 3 typical what it takes?
You mean 3 days? Generally,
Yes.
we do, the first treatment is 3 days, and we see how the patient does, and we follow up within the 6 months and see if they need to come back for a repeat treatment.
Okay. Well, Dick, I want to thank you for giving us a call today and talking about how it's worked for you.
Okay.
All right.
And I do want to say one more thing about their office. It's not a typical doctor's office because the girls there keep up with you and they call you back.
That is not a typical doctor's office. I'll tell you that, Dick.
They keep me informed.
Is that just when you have questions, or they check on you in between?
They check on me in between, but they're there always to answer my questions.
Very nice.
Especially about what I'm supposed to eat.
All right. Well, thanks for calling in, Dick. And if anybody else has a question, feel free to give us a call at 877-897-8255. So, I mean, you're really seeing, like you said, this. You started with your father, and obviously it's typically what your clientele, your patients are 60 and over.
Typically, yes.
Okay, and this is the kind of results that you're seeing where people are able to get active again. They're able to, live a life that they used to live.
That's correct. Not everybody responds well to the treatment, but a majority of people do. And that's remarkable considering that nobody gets better with the other form of treatment.
Well, it's just I hate to put it this way, but it's a slow death.
Correct.
Right, and all you're doing is you're just treating it. You're not curing it. You're never going to improve it the other way. It's just something that's going to continuously get worse.
That's right.
And so,
That's right.
so talk about the treatment is using a patient's own stem cells. Is that correct? Is that the main part of the treatment?
Actually, that is part of the treatment.
Okay.
We use the patient's own stem cells, and we are able to give them a growth factor that's very powerful and causes a release of stem cells from their bone marrow in large numbers. All blood drains to the lung, and stem cells go to the lung, and for some reason or another, they are trapped at the lung.
Okay.
Those bone marrow stem cells are trapped there, and then they are able to sense the inflammatory response that's going on there, and they begin secreting growth factors that actually reduce the inflammation and hopefully reinstate the healing ability of the stem cells in the lung itself. But we also use laser therapy to the lungs. The laser therapy is harmless, but it is able to penetrate through. That was one of the first treatments that I did on my dad that surprisingly he got a huge benefit from.
Right.
And so we use laser therapy as well when the patient is here. And then we also put a patient on a regimen of stemkine, which causes a showering of stem cells. Stemkine is an oral supplement that causes a showering of stem cells. At the same time, we have them breathe all trans-retinoic acid. Those two work together to help the lung repair itself. And we put patients on that for 6 months after they leave here.
So we've got another caller on the line. It's Charlie from, if I'm correct, Bradenton. Charlie, how are you today?
I'm very good.
What would you like to say?
Well, I'm a patient of Dr. Burke. I had the treatment done around Thanksgiving time last year, and I've had tremendous success with it. I'm a so-called snowbird. When I get down here in October, I wasn't able to do much walking. I wasn't able to do hardly anything. Now I'm walking. I'm riding my bike every day. I'm just so happy with the success that I have so far.
That's incredible.
Hoping to get better,
Well, it sounds like you are. I mean, it sounds like you're really on the mend. And, obviously going to USA Stem Cells has worked for you. And it was a pretty easy treatment, wasn't it?
It was very easy. I'm, by and large, a nervous person, and I was very nervous to go into it. But it's very simple and easy, and his staff, the girls over there are tremendous, and Dr. Burke himself too. But I mean, everyone involved in this treatment treats you very, very well, makes you very, very comfortable.
Wow. And have you gone back for any extra treatments or just had the one treatment?
I just had the one treatment, and I'm scheduled. And here again, I'm not sure. I'm going back to see him sometime in April, but I don't know the date in front of me,
Right. I mean, you got to go one more time before you go home up north and everybody sees how good you're doing.
Well, this is what I'm hoping for, yes.
Well, Charlie, thanks so much for calling us, and we're going to send you a little prize package. Stay on the line, and we're going to get your address.
All right. Thank you very much.
All right. So, Dr. Burks, I mean, we're hearing from people that this is really working. And the treatment is, like they both said, it's a pretty easy treatment. I mean, I know you talk about the laser. It's completely non-invasive, right?
It's completely non-invasive. It's very, very relaxing, as a matter of fact, to have the laser.
Okay.
Many people go to sleep while they're having the laser being done. And it's just the application of the laser beam on the outside of the chest. And you know how you see laser beams as very focused and maybe they can cut through things. This laser beam is diffused. It has a head on it that causes the laser light to spread out, and so it doesn't do any cutting. It's completely comfortable.
Okay. I'm sure you probably get a few questions every now and then. Oh, is it safe? Especially with people that aren't as technologically literate.
Actually, you'd be surprised how many pulmonologists are skeptical about the laser.
Wow.
Because they're unaware of the technology of this type of equipment. And actually, laser-like stem cells are really underutilized in the United States, and being able to use both of them freely, we could do a tremendous amount of good for people who are suffering.
And what's the success rate you're seeing at this point?
Since we added the laser, we have about it's over a 60% positive response rate.
Okay. And we should clarify that this is for a certain type of COPD. There's other COPDs that it's different. It doesn't work for, correct?
There is an inherited COPD. It's alpha-1 antitrypsin is an enzyme, and a deficiency of that causes COPD, and the stem cells won't. That person's stem cells will carry that defect, and they won't repair the lung, or if they do, it'll be very temporary.
Okay.
The deficiency will continue to break down the lung.
But you guys will interview each potential patient and know that ahead of time at no cost to the patients, correct?
Correct. We interview everybody. Not everybody is a candidate for stem cell therapy, so we interview everybody and make sure that they're able to travel to where we are. If they're far away, we make sure they haven't had a cancer in the last 5 years, and we make sure that they don't have the alpha-1 antitrypsin deficiency, and if they do, it has to be fully treated.
Okay. And then, so last time you were on the show, you talked about the treatments at home. So they have to change some of their lifestyle a little bit, don't they? Obviously, they have to quit smoking, right? But they've got to change a little bit more of their lifestyle, don't they? Maybe foods, things like that.
Right. We don't take them if they're smoking still.
Good choice. I like that choice.
And something I wanted to comment on is I think that people who have COPD at its worst and are still smoking think there's no need to quit smoking. I'm going to die anyways. I'm so bad off. I've hurt myself so much. So when they quit and then they can get this treatment and get such an improvement, isn't that a great motivation to keep from going back to that? They know they can never go back, but they can see that they have such an improvement in a short amount of time.
Right. And I explained very carefully that the smoking will negate the effect of the therapy completely.
Right. And so go into the the changes in maybe their eating habits and their lifestyle that you put them through as well.
Yes, we put patients on an anti-inflammatory diet, which is fairly rigorous for a lot of patients, especially in that age group. And there can be some whining and crying about it, but I explain to people that there's no diet and there's no food worth dying for, and they really need to help their body by putting the right type of food in it.
And what types of foods are those that they want to eat?
Well, they want to eat steak and potatoes.
No, I mean that's good for them to eat. Can you eat that, or you're talking about you need to switch to fresh fruits and vegetables?
Yes, you need to switch to fresh fruits and vegetables, wild-caught fish, poultry, those types of things.
Okay.
Some of the patients that are diabetic, we take them off of wheat products.
And are you putting them on a gluten-free diet?
Yes.
Okay, that seems to have worked, is working for a lot of people.
And for a lot of diseases, not just this.
Right.
All kinds of people are saying, I got off of wheat, I got off of dairy, and they're eliminating a lot of issues.
Right. And, we, especially in COPD, we have them not use dairy because it thickens secretions.
Right. Well, I remember my mother used to always tell me, you've got a cold, stop drinking milk.
Yep.
Your
mother was wise.
So now, all they got to do is call. And now, unfortunately, insurance doesn't cover this yet, right?
No, it doesn't.
Okay. So but in the long run, I mean, they're really going to change their life. I mean, it's worth what you have to pay for it if you can add another 4, 5, 10 years to your life and at least be able to get around.
Oh, absolutely. And being ill, having COPD is expensive anyway.
Right. And so, obviously they've got to quit smoking to come to you, but they've really got to look at making some changes overall in their habits and their eating habits and then commit, because you put them on supplements and another type of program as well.
Exactly.
So, well, I'm telling you, it sounds like it's working great. We've seen it. We've seen one of your patients. I mean, it's a dramatic improvement that we've seen. And I want to let people know how to get to you. It's on the web, usastemcells.com, and it's 877-578-7908. Thanks so much for joining us, Dr. Burks.
My pleasure. Thank you.
And we're going to have you back again to talk about this because this is the stuff we like, the stuff that's working, right, Deb?
That's it.
All right. Have a great week, Dr. Burks.
Something else that people, if they get to their website, there's a bunch of testimonials with people telling their stories on there, and you can see them. I mean, you can see their videoed right there, and you can listen to their story.